Welcome to our video about fungal nail infections. What are fungal nail infections? If you've ever wondered what fungal nail infections are, you've come to the right place. Read on to learn more about the symptoms of this infection and how to spread it to others. Then, you can decide whether to seek treatment. Here are some tips to help you get started. To learn more about fungal nail infections, please refer to the links below. This article is not meant to replace the advice of a doctor. What are fungal nail infections? If you've ever wondered if you have fungal nail infections, you're not alone. It's not uncommon for people to develop nail infections of a different type. There are several symptoms that are common for fungal nail infection, and it's important to seek medical treatment for the correct diagnosis. However, it's also important to note that a fungal nail infection can be mistaken for other conditions, including psoriasis. Regardless, a diagnosis of a fungal infection is the only way to determine whether you have the infection. These infections are usually caused by a fungus, which can live on the dead tissues and outer layers of the skin. It is common for fungus infections to develop on fingernails and toenails and to occur following a fungal infection in the feet. Fungal infections are more common among adults than in children, and it is most common in older people. People with poor health or diabetes are also more susceptible to fungus-infected nails. Smokers are also at higher risk for nail fungus infection. Treatment for a fungal infection usually involves the application of an antifungal cream or lotion to the infected area. Although this approach does not completely eliminate the fungus, it does often clear the infection. The best way to avoid getting an infection in the first place is to keep your skin dry and wear dry socks. You should also wear roomy shoes to avoid sweating and wet feet. Using shower shoes or shower sandals will also help keep your feet dry. And remember to not share nail care items with other people. Fungal nail infection symptoms. Several common fungal nail infection symptoms can be easily treated over the counter or by visiting your podiatrist. Treatment options include prescription or over-the-counter products such as mycosin fungal nail. If treatment does not clear up the infection or spread to other nails, it is best to consult a physician. If you are pregnant or diabetic, you should get a doctor's advice before beginning treatment. Infections of the toenails are often a symptom of a more serious bacterial infection. If left untreated, the fungus can spread to the blood and bones. The more nails are affected by an infection, the more likely it is to remain. During treatment, fungi are not likely to spread to other parts of the body, but it can be very uncomfortable to walk around with infected toenails. Fungal nail infections start with a white or yellow spot under the nail. As the infection progresses, the nail discolors, thickens, and crumbles. In some cases, more than one nail may become infected at a time. If you see these symptoms, you may be suffering from fungal nail infection. If you have any of these symptoms, you should see a doctor immediately. About fungal nail infections. If you have a fungal nail infection, you probably know how difficult it can be to get rid of. Treatments often do not cure the infection completely, and recurrence is common. Prevention strategies include washing hands frequently and thoroughly, keeping nails short and clean, and wearing shoes that allow moisture to escape. If you are in a public restroom, wear shower sandals or flip-flops, and avoid sharing towels with others. Fungal infections of the toenails usually begin at the front edge or side edge of the nail. It's rare to find them at the base, but this can happen. People with weakened immune systems or serious illnesses are more likely to develop these infections. The fungi that cause these infections are called dermatophytes. They are also sometimes called yeast. Symptoms vary between different subtypes. Here are some common signs and symptoms. Treatment for advanced mycosis often requires oral medication, and consists of taking terbinafine, Lamisil, tablets once or twice a day for 6 weeks to 6 months. Terbinafine can cause minor side effects, including temporary loss of taste. It's not advisable to use terbinafine alone, however. Taking it over an extended period may cause adverse effects. In addition to terbinafine, other medicines such as itraconazole or fluconazole are good second-line treatments for fungal nail infections. How fungal nail infections spread. The first step in treating a fungal nail infection is to get an antifungal medication. Usually, you can purchase over-the-counter medicine, but if you are experiencing severe infection, a doctor will prescribe a stronger medication. These medicines are often the most effective, but they can also lead to serious side effects. Luckily, there are several treatments for fungal nail infections. Keep reading for more information. You can prevent nail fungal infections by ensuring that you clean and disinfect nail clippers and other tools used in nail care. In addition, you should make sure that your nail salon uses disinfectants. These tools can transmit the infection. Fungal nail infections are more common in adults and men. People with weakened immune systems are more prone to developing this infection. Also, the nails of older adults grow slower and thicker. Getting an infection at any age is never a fun experience, but it can be managed. The most common type of fungal nail infection is called distal subungual onychomycosis, which begins in the skin beneath the nail. As it grows, it invades the nail bed. It produces inflammation where the nail meets the nail bed. This inflammation causes a jagged appearance and can be very painful. Another less common fungal nail infection is known as white superficial onychomycosis. It affects the surface of the nail, and it can lead to crumbling or brittle nails. Fungal nail infection diagnosis. A physician can perform a fungal nail infection diagnosis using a variety of tests. The doctor may prescribe antifungal medication, either in tablet form or special nail paint. Some people do not require treatment, however, if they do not care about their appearance, do not have symptoms, or do not have comorbidities. The medication may be oral or topical, with oral medications being prescribed for multiple nails. During treatment, blood tests may be performed. The diagnosis of a fungal nail infection requires a doctor to examine the fingernails and toenails. The doctor may also take a sample of the nail clippings or debris under the nail to identify the type of fungus. The doctor will determine what type of treatment is best for the patient. To help prevent a fungal infection from coming back, keep nails short and straight, and change your socks when you're sweating. If you've suffered from a fungal infection in the past, your doctor will most likely prescribe oral antifungal medicines. These medicines will work by inhibiting the growth of the fungus, causing a new nail to grow. However, oral antifungal medicines may not be appropriate for people with liver or congestive heart failure. The doctor will determine which type of medicine is best for the patient, and the treatment period may take several months to a year. Fungal nail infection treatments. If you're looking for a treatment for your fungal nail infection, you need to know what your options are. While self-care strategies and over-the-counter drugs can help, these are not effective treatments for fungus. Treatment options depend on the type of fungus and the severity of the infection. It can take months to see results, and repeat infections are not uncommon. You can use antifungal drugs, applied directly to the affected nail, or both. Topical antifungals are an excellent option for treating your fungal nail infection. These medications kill the fungi that cause the infection and may also kill other pathogens. Some are available outside of the United States, but can also be purchased internationally. Examples of topical antifungals are amorolfine, terbinafine, and tavoborol 5% solution. Other types include butenafine, terbinafine, and griseofulvin. If you're concerned about the infection, you can visit your dermatologist. Your doctor will examine your nails for signs of fungus. He or she may also take a sample of the infected nail. Sometimes, this sample is taken from under the nail. After the sample is taken, your doctor will send the sample to a lab for analysis. Depending on the type of fungus, you may need different types of treatments. Risk and prevention for fungal nail infections. While any individual is susceptible to fungal nail infections, certain factors may increase your risk. For instance, if you are a diabetic, have a weakened immune system, or live in a hot, humid climate, you're more likely to suffer from fungal nail infections. Additionally, people with certain health problems, such as Down syndrome, are also at a greater risk of developing these infections. Despite the many ways to prevent fungus from growing on your feet, fungal nail infections tend to recur. To reduce your risk, wear socks and shoes that allow moisture to drain. It is also a good idea to use shower shoes and flip-flops in wet public areas. Avoid sharing towels and other personal items between family members to avoid passing on the fungus. And, last but not least, never wear footwear that contains a fungal infection if you are infected with one. Certain risk factors for fungal nail infections include poor hygiene, underlying disease states, and high-risk occupations. Infected individuals have a weakened immune system and can spread fungus through contact with unclean objects. People who share a glove or protective gear are also more susceptible. Finally, older adults are more likely to develop the infection because of poor circulation in their hands. Furthermore, their nails tend to thicken and grow more slowly as they age. Thank you for watching. Please like, comment, and subscribe if this was helpful.